Hello and welcome to the Interact podcast series. In this episode, we're sharing the stories and experiences of new mothers and their carers. Around 1 in 5 women experience mental health problems during pregnancy or within the first 2 years of giving birth. Perinatal mental health problems are not often discussed openly because of feelings of embarrassment, shame, and fear of the consequences, yet according to NHS figures, over 57,000 new and expectant mums have received specialist support for mental health problems over the last year, up a third on last year's figures. You'll now hear stories from some new mothers and their carers living in Kent: Neve, Rose, Brittany and Heather, which are not their real names.
I remember she apparently had that baby in a routine at like 6 weeks, and I was like, oh my god, I need to do that. And
Neve is a new mum in her early 30s, living and working in East Kent with her partner and 2 young children. She openly discussed with me her experience of poor mental health after the birth of her second child, the stigma associated with poor mental health in motherhood, and the importance of honest and frank conversation around the challenges of motherhood.
I had a 3-year-old and then I had another baby, and it completely blindsided me, like how difficult that was, having a second child. And so, my mental health just like tanked after I had the second one. I think it was like after my youngest was born, I was having more days on the whole where like I just wasn't feeling good. It's like very teary. I get like, again, just like questioning things like, have we made the right decision? Like, what does that mean if I'm even thinking that? And being aware as well that our family support was about to leave, and so I think that's probably when I contacted the health visitor, and was just like, I think I probably told them that like I felt like I wasn't coping. I think that's what I remember saying. I ended up having some talking therapy on the NHS through the health visitor. The health visitors were very supportive, mostly. But I also remember a few home visits where I was like very upset and trying to communicate about like poor mental health and stuff. And I think they're just doing their job around safeguarding and things like that, but they have to go through, I can't remember, there's like an acronym, and it's something to do with like the things you need to be aware of if you're feeling, if you're feeling really low and your mental health is affected, and it's regarding like getting to a point where you might do something like shake your baby or something. And I remember them having to go through that, and again just feeling like, oh my god, do they think I'm going to shake my baby? And also having like sort of really tough nights with a newborn where like I can't sleep and I'm hysterical, and being like, oh my god, am I actually going to, like, they've said that now, like, am I actually going to get to a point where that's going to happen?
I asked Neve if she feels there is a social stigma attached to talking honestly and openly about experiencing mental health challenges in motherhood.
I think there still is a lot of stigma around, like, people just don't talk about like that after you've had a baby, like that you might feel like that. I'm not sure that anyone is ever completely honest about their experiences, and obviously a lot of the time it's just you and the baby, or you and your family, your partner or whatever. So there's no one else around to see what it's actually like, and I think that's part of the problem. Yeah, on Instagram there's a few accounts that I'm aware of, and I'm sure there's more, where again mums are just very honest about motherhood and about the sort of the less positive sides. So I think one of them is called Mother Pucker, and she's like she's really good, and she just posts a lot about how mums should be able to communicate like when they're not having a good time, and actually you don't need to feel like you need to be grateful every second of every day. Like, it is hard, like raising children is hard, we need to talk about that. And I guess it just makes you, to use like a word that I think gets thrown around a lot, but it is relevant, like it just makes you feel seen. like someone else is having that experience, and because they are, then you feel like, oh, it's not just me, like I'm not like the odd one out, I'm not like doing something wrong, I don't need to feel guilty about it because someone, like all it takes is just one other person to like to say actually no, that's me as well, like and then suddenly like you're validated and you're like, oh, okay, like I'm not like an awful person or like a bad mom or something. Yeah.
Many women we spoke to voiced their fears around the consequences of talking openly and honestly about their experiences of mental ill health in motherhood. Rose is in her early 30s and is originally from the United States but has lived in Kent for a number of years.
I'm originally from the United States, but I live in Kent. I like how old everything is. It's a lot smaller. But no complaints. I'm still here. If I suppose I always tell people if I didn't like it, I'd be out of here.
Rose shared her personal experience of feeling abandoned after giving birth and the lack of support she received.
Yeah, and like it is really scary, especially when I was freshly had my child. I was like so scared social services were going to take her. I was like, no, I would never hurt my child. Like, I would never hurt my child. I'm just scared of anything happening to her, and I want somebody to talk to about it. Do you know what I mean? We have that big, massive drop of hormones after you give birth, and your mental health just goes through the ringer. Do you know what I mean? And there just wasn't a lot. I just felt very alone, basically. So.
This was echoed by Brittany, a mum of 3 children from Kent.
I've lived in Kent my whole life. Yes, it's gone downhill, but I suppose there's good and bad everywhere. And it's not the worst place, but it's not the best place, I would say, you know.
Brittany shared her personal experiences with mental health disorders, including depression, postnatal depression, and borderline personality disorder. She discussed the challenges she has faced in seeking help due to the stigma surrounding mental illness.
I think there's a massive stigma still about mental health. Like if I tell people what I've got, they're like, "Oh," and I think I'm not a bad person. Like I've got this because bad things happened to me, and no one should be embarrassed to admit that they've got some sort of mental health condition. Yeah, I just feel like you're treated like a second class citizen, like and then to be very honest with the mental health services, you can't be completely open and honest because then you're putting your children at risk. And then my husband actually, because we'd split up, he come back because I was like, well, if there's not another adult in the house, they're going to take the kids. And so he come back because they were like threatening to take the children, which doesn't. I'm not a bad mum. Like you can't be completely honest with them because then it will flag up that your kids will, yeah, they'll flag up something, and then your kids will be under social services, and then you might not be allowed to be around your children, not because you're a danger to them, but you're a danger to yourself. But yeah, it's just so very misunderstood, and being a mum gets in the way as well of you getting help. But there needs to be help that is not going to put my kids at risk as well, because there was times that I thought, oh, I ain't telling them that because they'll take my kids.
The risk of children being taken away, if fully honest about mental ill health, may prevent new mothers from getting the help they need. In some cases, it can even be hidden from those closest to you until it becomes a crisis. Heather is a carer peer support practitioner living in Kent. She discussed her experiences as a carer for her daughter, who suffered with postpartum psychosis, highlighting the importance of empathy and understanding and the need for more awareness and support.
My daughter became very unwell 5 months after having a baby with postpartum psychosis. And she was put straight into a mother and baby unit. So I had to become one of her full-time carers, which I did for 18 months. And I really found through that time caring for her, which was really hard, very distressing, didn't know anything about psychosis at all. I felt there was no support whatsoever for the carers. The baby was 8 weeks early and it was quite a traumatic birth. Both of them were quite seriously ill afterwards. And she stayed in hospital with him for 8 weeks while they're going through the neonatal NICU unit, they called it there. And then he had a few allergy problems and then he started screaming a lot. So I know she was lacking in sleep. But I didn't see any other change in her really other than her being tired. And then her husband one day received a message from her totally out of the blue saying the house was surrounded with people with guns and the baby was in her crib, but she couldn't do it anymore. And he'd had half an idea that she possibly was having a bit of postnatal depression, but no more than that. But once he received that message, it frightened him, and he went home and sort of forced his way in and literally scooped her up and took her to his GP, who referred her the very next day to a mother and baby unit.
Heather described how she felt unsupported and lacked the knowledge to advocate for her daughter at a crucial time in her life.
Anytime I put anything in a search for carers for people with psychosis, nothing was ever coming up. The only thing that did come up was a charity called Action Against Postpartum Psychosis, which both me and my daughter volunteer for now. I think until their loved ones are willing to open up about what's happened to them, I don't think carers feel it's their story to tell until then, because my story is my daughter's stories as well. So up until the point she didn't talk about it, then I didn't feel I could talk about it. Once she did, then I was more open to talking about it myself. Her spreading her story has sort of opened eyes to a lot of people, and me telling my story through her as well has opened eyes to a lot of people. And the more we can do that, the better.
Through openly and honestly talking about their experiences of perinatal mental health conditions, women are coming together to raise awareness and destigmatise mental ill health in motherhood. My name is Sam Holmans-Thompson, and along with my colleagues, Professor Lisa Diakomitis from the University of Kent Centre for Health Services Studies, Joseph Price, Gloria Oluwaseun, and Professor Suki Shergill from the Kent and Medway Medical School, we spoke with people from across Kent about their experiences of mental health and mental health care services, and how we can better engage diverse and unheard communities with mental health research. The Interact research team worked with new mothers, older adults, young adults, and members of Kent's ethnic minority communities. Together, we creatively explored how people think about their mental health and how they see the future of mental health care in Kent, so we can ensure mental health care addresses the needs of these local communities and tailored services are available and can be accessed by everyone. Interact is one of 10 projects supported by the UKRI Arts and Humanities Research Council to coincide with the 75th anniversary of the NHS. All 10 projects involve collaboration with new and diverse audiences whose voices are not often heard as part of national debates on health and social care. The aim is to help inform researchers, healthcare practitioners, policymakers and the public about the future of care. Thanks for listening.
Thank you to Sam Holmans-Thompson and Joseph Price, our fantastic research assistants, for engaging so deeply with community members and for making sure that we truly included a wide range of diverse voices in the Interact study. I am Professor Lisa Digomitis, and with my colleagues Professor Suki Shergill and Dr. Dieter de Klerk, I would like to thank our funder, the UK's Arts and Humanities Research Council. But most of all, I would like to thank all our participants, community members in Kent, for engaging with our research. You showed us how we can ensure that mental health research in Kent must not be about you, but always with you. Your contributions were invaluable, and this work would not exist without you.